New Alliance Talk. Data at the Crossroads, funding for Africa's climate health revolution. Please welcome to the stage, Harvey Knight from Sustainable Times.
Good morning, everyone. My name is Harvey Knight, the founder of Sustainable Times. I'm delighted to moderate today's critical conversation, Data at the Crossroads, funding for Africa's climate health revolution. Now, today's climate crisis is already a health crisis, and Africa, more than any other region, feels this the most. 250 million people are impacted, and by 2030, $12.8 billion annually will be needed to strengthen the African health systems against the climate shocks. But how do we move from knowing the problem to financing the solution? That's what we're here to discuss. Through a unique collaboration, the Climate and Health Data Hub and the Pan-African Partnership on Climate and Health. We have a bold opportunity to build centers for climate and health that turn data into decisions and decisions into funding and funding into impact. So today we're asking, how can data empower sustainable financing for health and climate in Africa? And what role can you play in scaling this revolution? To paint this vision and ground us in the work ahead, I'd like to welcome Dr. Gitahi, CEO of Amref Health Africa, a leading voice in rethinking Africa's health future.
Wow, thank you, Harvey, and good morning, everybody. Good morning. Thank you. Good. Let's keep up the energy, because we are discussing something that is so crucial, not a risk, a reality. That's what is going on right now. We know that the climate crisis is with us, and for those vulnerable communities that live where I come from in Africa, when they have a drought, or they have a flooding, or they have a new malaria case that happens, or there's a cholera outbreak, they don't know what UNFCCC is. They don't know what the COP29 or 28 is. They don't know all the debates that are going on data. They just know that their lives are disrupted. They don't know why, but their lives are disrupted. And what we found is that in trying to resolve this problem, a problem that communities in Africa face with minimal contribution, I don't know how many of you know in some countries like DR Congo and others, the carbon metric contribution per individual is 0.7 metric tons of carbon. But it's an average of 11 metric tons in Europe. It's about 14 metric tons. So these people contribute so little because they don't even have energy to survive, are bearing the largest impact. And this is what we like to say. It is actually that you contribute so little, but you have no discount for the lack of contribution. The impact is meted equally, and because of the vulnerabilities that exist, the impact is actually multiplied and disproportionate because the contribution is none of your own making. But when we bring this argument to the COP process, to other processes that are discussing climate, we feel like a young man who is doing his wedding on someone else's suit. You're wearing someone else's suit, but you're in your own wedding. Because the data that we have to present, and we'll hear a little more from the processes that matter, the data we have to take to COP, to the UNFCCC, to the governments for them to actually realize the challenge that vulnerable communities are getting, especially on health, from the climate transition, the global warming. That data is borrowed. It's not our data. It is actually data borrowed from those who have data. We have minimal funding for research in the continent of Africa for climate and health. So when we take it to governments and say, we would like you to change your nationally determined contributions and ensure that climate adaptation and vulnerability recognition is actually in the NDCs, they say, where is the data? And the data that we have is only that is published in global journals by those who have the money to undertake the data, and that data is relying on other communities, not the ones that are most vulnerable. For us to get the right data, we need not only to have the research-driven data, but we also have communities, indigenous, and community data, information that may be qualitative as well, storytelling. Our people know when it's about to rain. They know the patterns. That data is not captured. And that data is part of what can be used to create early warning systems. So at Amref Health Africa, working with partners like PACJA, and Mithika is here, he'll talk about PACJA, working within the partnership for climate and health that we created for Africa, that was launched at COP29. We have worked with our partners, including Wellcome Trust, and IDRC and others, to start climate and health data hubs. These data hubs will be spread across the continent so that we have adequate data, not only from just researchers, but from communities themselves. And we'll hear a bit of that as well, because we have a young person also here who is doing climate action. Wadoto has joined us, tell us, what data are you using for mobilizing communities, for policy change, and for action? And that data needs to be context specific, needs to be produced by the communities that are using it, and then go upwards to inform the IPCC, the UNFCCC, and the COP process, so that financing for climate and health adaptation and its role in mitigation is financed using data that is specific to the communities that have the largest impact. This is why we are here, ladies and gentlemen, and I would like to hand over back to Harvey so that we can listen to those who have the knowledge to inform us on what we need to do next. Thank you very much.
Thank you, Dr. Gitahi. I'd like to welcome to the stage Dr. Njenga, Minister Chimpeni, Dr. Mwenda, and also Elizabeth. So welcome to the stage. Thank you. So to kick things off, Dr. Njenga, despite Africa bearing the brunt of a climate impact, health remains marginal in most frameworks and obviously global finance flows. So reliable disaggregated data is a fundamental tool to change this narrative. So Dr. Njenga, what data gaps are crippling the health responses to climate change in Africa?
Thank you very much, Harvey, and really it's indeed a great pleasure to be joining this distinguished panel, and thank you very much, Dr. You know, the UNFCCC process is designed to be informed by the best available science, and it is actually working through informed science, and therefore our relationship with the IPCC, the Intergovernmental Panel on Climate Change, and the WMO has been critical. So the question of the data gaps in Africa's climate health response, for me, is not a technical issue only. It is actually a governance issue. It is an equity issue. And therefore, without the robust data that is required to inform these scientific processes, the timely data that policymakers can take, the data that negotiators often lack, and thanks to the creation of this new Africa Hub. And this is really where the IPCC decided to also, in its international architecture of developing and generating science and data, to have a regionally informed ARC. This is really the research assessment from the region. However, we continuously see that this regional approach continues to lack the data and the robust data that we need. And therefore, for me, sitting at the intergovernmental process, what I see from the multilateral perspective is that this gap is actually crippling the collective ability to integrate health into climate planning. And especially now that countries are in the process of designing their new NDCs, the nationally determined contributions, and NAPs, and therefore the need for urgency in terms of developing not only these capacities, but ensuring that they are well financed to generate the best available science within the African continent.
Thank you, Dr. Gitahi. A strong argument for why local, obviously responsive data is obviously a must for underpinning the health systems. But just to carry on that conversation, in your view, Dr. Gitahi, what role can regionally owned data, obviously platforms, play in elevating Africa's voice within the UNFCCC process?
I think for me, it's the urgency. So the real-time data, we are increasingly also hearing the importance of not just citizens' data, but also integrating indigenous knowledge into the process. For me, this exposes a very complex arrangement that requires enforced capacities, not just for the scientists, but the social scientists too. So not having just scientific data coming for the physical sciences, but also for the social sciences in order for us to understand the integration of climate. We are talking about greenhouse gas emissions that are measured scientifically, but we are also talking about the waterborne diseases that are being experienced. We are talking about the heat and the communities not being able to cope with increased temperatures, and these emanate themselves in not only social reproductive situations, but also in the health of children, of people. And therefore, for me, that socio-economic data should be paired with scientific knowledge of greenhouse gas emissions, and that data should be available in a timely manner.
Excellent. Well, great reminder why that data isn't just technical, right? It's political and strategic as well. Now, moving over to Minister Chimpeni. Obviously, Malawi, like many African countries, experience climate shocks that directly impact public health, Minister. So what is your vision on how the national centres will inform national and continental climate health policy and negotiation?
Thank you very much. Chimpeni is here this side. Thank you very much, organizers, for inviting Malawi to take part in this discussion on climate change and health. It is an honor for me to be here this morning. Climate change significantly impacts public health, requiring integrated health policies to address both the effects and the health sector's contribution to emissions. This includes strengthening health systems to prepare for and respond to climate-related disasters, transitioning to low-carbon practices in healthcare, and addressing the root causes of climate change. A global approach is needed to ensure health central to climate action. Malawi, like any other African country, has not been spared from the effects of climate change. We have seen rising temperatures and floods. Malawi has recently been devastated by cyclones Freddy and Anna and Gombe. This has led to untold misery, destruction of health infrastructure, loss of crops which had matured, and leaving a lot of people destitute. These have increased the prevalence and geographical spread of climate-sensitive diseases. These include vector-borne diseases such as malaria, waterborne diseases such as cholera, as well as malnutrition, respiratory diseases, and non-communicable diseases, among others. Moreover, climate crisis is rapidly deteriorating access to basic health, safe drinking water, and sanitation and clean air. Consequently, Africa bears the brunt of climate change as they already face higher levels of poverty and income inequality and weak health systems. For example, I can give an example, like in Malawi, so when we had the cyclone, the whole power station was wiped out, meaning that once that is done, the first thing to be affected was our national budget. Once that it doesn't only affect one area, it means it affects the whole country, because the planned budget cannot be effectively implemented. What was meant, for example, buying medications, government will now have to channel those funds to other areas. And again, you find that once the infrastructure is damaged, service delivery is affected, maternal health is affected because a whole maybe health center, people cannot access any services there, meaning now whatever gains we've made in maternal health were being reversed. No any other services can be affected. So that's why it's very important to budget for climate change as we speak. Thank you very much.
Thank you, Mr. Chimpeni. And obviously, thank you. Policy can only be effective if, of course, it's grounded in real local evidence, right? Which makes sense. And just going on, Minister Chimpeni, what institutional capacities are needed within ministries of health to make full use of the climate health data for planning and budgeting?
I think what is needed is for the national vision, these centers, and for Africa, that is able to respond to climate change and effects on the health of the African people. We need to provide reasonable action choices, hopes and desires to tackle the effects of climate change with health, create a bigger and better future for Africa by eliminating the disastrous effects of climate change on health and economic development. Help us set a determined direction for planning and execution of strategies to deal with climate change effects. Align all countries in Africa on our direction in dealing with climate change and its effects. Inspire African people on how to tackle the issues on climate change and health of the people. Once again, data is required. It will be easy to look for resources aimed at mitigating the effects of climate change in health and African economies as a whole.
Excellent. No, thank you. Obviously, capacity building is clearly a critical pillar, right? Not just the data, but the people, the systems. It's required to bring in the right solutions. Now, Dr. Mwenda, obviously, civil society has a critical role in pushing data into action. Now, turning evidence into financing, accountability, and social mobilization. How does civil society mobilize and turn data into financing and accountability?
Thank you very much, and it's a great pleasure to be in this very important panel. One of the things which we have to acknowledge in the evolution of the discourse on climate change is that over time, it is no longer the issue of science, nor is it the issue of environmental community. As Cecilia has rightly said, it has evolved into now that intersection of health, for instance, is really reveals a very complex, multifaceted, landscape. And so, acknowledging that the manifestation of climate is seen in health, as Githinji was saying that when there is that drought, what do you see? Malnutrition from malnourished children in the Horn of Africa, in the Sahel region. And when there are floods like what's happening in Nigeria, and what is happening there in what he has mentioned in cyclone, all this manifested through the health sector. But do we really acknowledge that? Over time, we in the civil society, other non-state actors have been working with governments like government of Malawi and other actors not to do that we are going to do it, but we are doing it now. Like for instance now, we are trying to see how we can hold the governments accountable for particularly the implementation of the NDC's nationally determined contribution and ensuring that the health sector is really captured. The current, the NDCs which we are trying to revise really lacks that really strong language on health. So that's what we have been doing. The other point is not that we are going to do as the role of the civil society. We are catalyst of change. We are a catalyst of transformation. And the things which we are doing with the Amref, among other civil society, is to ensure that we provide that data which do not exist. And currently, we have been facilitating conversation, not only among civil society, but even with governments and also other non-state actors. And we have held around 3 conversations at Pan-African level, trying to bring stakeholders really to acknowledge the role of climate in the evolving in the climate crisis. And so right now, we have established the Pan-African platform for climate and health, bringing together key health organizations in Africa, key climate organizations, and increasingly it is becoming one of the best platforms really to bring stakeholders together. And so for us, it's not waiting to be told, do this. Already we are doing that, and we believe that this alliance is going to evolve, and the only challenge which we have is funding. What kind of funding do we have? How do we work with the UNFCCC? It is not actually about funding. What resources do we have? Human and the capital.
Excellent. Thank you, Dr. Mwenda. Absolutely. Communities, not just beneficiaries, right? They are the engines of innovation and accountability. Another question for you, Dr. Mwenda. I mean, how can civil society ensure locally collected data informs both community-led adaptation, but international financing mechanisms as well?
You know, the issue of, as you know, the issue of funding, particularly within the UNFCCC and multilateral systems, is quite emotive. The question is, where does that funding come from? Within the UNFCCC framework, the funding for climate is supposed to be grant-based. Yet we need to acknowledge the fact that the world has evolved. We need creative, innovative ways of financing, and this conversation is very important. The question is that, is it going to come from the private sector? And when we talk about the private sector, particularly in the African continent, where the priority is really adapting the climate systems, the adaptation in all sectors, are we going to talk about a private sector where adaptation is actually has no returns on investment? So what we need really to think about, but it is very inevitable that we need to be very creative, whether it is from the private sector, whether it is from CSR and many others, but really we need to think about it very creatively. Philanthropies, of course, are doing very well, Wellcome Trust and others, but really that is not sufficient.
Thank you. Thank you. A powerful reminder of obviously why climate health financing must be deeply rooted into the people. So just going on to the last panelist, Elizabeth, I know you was a late joiner for us today, and I know you represent the youth and the local communities. How do you see the role of youth and data and the challenges that you maybe come across at the moment?
Yeah, thank you. I think the conversation we're having here today is very critical because without real-time data, it means that the policies that we are making and the progress that we are trying to make as an entire globe is all going to be misdirected, because on what basis are we taking that action, and on what basis are we saying that this policy works for this country or this policy works for this community? And I also believe that this is data that needs to incorporate both modern day science and also the indigenous knowledge systems, because communities on the ground that are most affected by climate change, they do understand the challenges that they are facing. They have solutions they're taking up on the ground, and they are also the most impacted by these impacts. And as we have been engaging with communities, children, and young people at the Green Generation Initiative, we've also seen some of the challenges that have really been clear in terms of the nexus between climate and health. And of course, one of these challenges being the aspect of the extreme and unpredictable weather patterns right now. And this means that also the early warning systems is really key for the communities, because back then communities would predict when to plant, when to harvest. And right now with these unpredictable patterns, it's become almost impossible for that to happen. So how do we incorporate the early warning systems in a way that can support these communities to be able to even prepare for climate-related disasters? And some of these are actually health-related, because when we have like the extreme heat waves, there are climate-related diseases that could be an outbreak with these communities. And the other aspect is the disruptions to the food and water security, which is very critical and an opportunity for us to discuss and talk about the most important part of action, which is the people. So if we do not address this nexus, it means that we will not also be able to address the aspect of food and water security that has heavily impacted the children. And this is a challenge we've mostly seen even at the organization. And we've been working with children, including schools that have children with special needs that have challenges on malnutrition. And we've been establishing the vertical gardens to make sure that they have surplus in terms of the indigenous vegetables that they can eat. And at the same time, while we do conservation and protection of the environment, we ensure that the trees we're doing in these institutions, they do have a nutritional value to them, especially the mixed species of fruit trees that can enable them as well to build their resilience to climate change. And the other key issue that I believe has not been spoken about within the global climate and health nexus is the aspect of air pollution. And this is really affecting a lot of communities. And I believe even in terms of the health aspects, a lot of the respiratory and health diseases are linked to air pollution. But where is the opportunity to have this data across the African continent to understand the aspect of air quality at the same time, and what risks are we posing to the children, to the young people at the same time if we do not address this challenge? So I see a lot of opportunities within this conversation, especially how we can be able to focus on building climate resilient health infrastructures, because I believe in Africa, most of the infrastructures that we have are not built to also withstand extreme weather events like the floodings, the droughts, and even the energy aspect. Most of them do not have that reliable energy. That means that when power cuts out, there's a huge risk for people that are trying to also get access to healthcare. So this is very critical that we have this conversation to build the climate and health nexus and ensure that we have enough data, because it's upon data that we are able to know what is the best solution to take up for our community, and also ensure that data is not imposed, because people on the grassroots know what works for them. So we're not trying to build capacity, we're actually supporting them to continue doing what they're already doing to address their challenges. And I believe that's the most important aspect of the foundation. And also the youth-led solutions. The African continent has the youngest population in the world, with more than 70% below the age of 35 in sub-Saharan Africa. So how can we ensure that even with the data hub that we are showcasing the climate health nexus solutions that are already being implemented by the young people on the ground and that are scalable and that can work in many other parts of the world? I believe this should be a foundation, and because young people are the greatest resource that the African continent has. Thank you.
Thank you, Elizabeth. Very insightful and some key actionable sites. Thank you. Thank you, Elizabeth. Now, I'd like to invite someone from the audience to reflect on this question. From your perspective as global funders...
Moderator, excuse me. Excuse me.
Sure.
I think before you give to the audience, can I say something?
Sure.
Yeah. As much as we can talk about data and funding, we should also not forget about mindset change. Because I'll give you an example. In our country, we do have data sometimes, the early warning systems about when the rain will start. When, for example, we've got a lake, so sometimes fishermen are told not when to go into the lake, but they would still want to stick to their national instinct, challenging the data which is there. They would still go into the lake. We find that then they are made by bad weather in there. A lot of them drown. So there you are. Data is available, but people mindset change. They're not changing that to say things have changed. The other issue is on the same lake. It receded during the years. Now people started building tourist resort very close to the shore. What happened last year? You find that all those tourist resorts were flooded, some completely destroyed. So again, you're talking about mindset change. Again, I'm a member of parliament from where I come from. I was being hounded to build a bridge where people could not access health facilities when it rains. I built the bridge, but you find that people were cultivating upstream. So what happened is the river simply changed its course. So there again, we have got a bridge which cannot be used because people can't cross, because there's another river. The river has changed its course. So therefore, it means mindset change is also important as much as we can talk about data and funding. Thank you very much.
Thank you, Minister. That was very insightful. Thank you for adding that in. So yeah, I'd like to invite someone from the audience to reflect on this particular question. From your perspective as global funders, what are your thoughts on investing in climate and health data?
Thank you. Let me quickly get up and introduce myself. I'm Lisa Heinrich. I represent Wellcome Trust, and thank you. You've mentioned us and our funding in this context. But I wanted to quickly take a step back, maybe also for those who don't know who Wellcome is and what we do. We are a global research funder, and we mainly invest in research. And one of the priority areas we have is investing in climate and health. And within climate and health, one of our core priorities is indeed investing in data, because we believe that investing in data is really a core vehicle to understanding and helping people find the right solutions. I mean, people really have made that quite clear in their interventions, so I'm not going to repeat, but really there is a significant lack of integrated climate and health models, and we especially tailored to the African context, and we really want to support changing that. From our view, it is really important that we invest in the capacity building. We want to invest in the ability to collect and analyze the data, that it's analyzed by professional researchers that can really make sure that there is the evidence model behind it, and lead that research on the continent and really develop evidence and generate the evidence that is tailored to those very unique contexts, and that it's not data that is collected and developed in the global north, but that data is collected on the ground and researched and evidenced on the ground. So I invite everyone else that wants to say something from a funding perspective to make another intervention, but thank you for giving me this spot.
Thank you, Lisa.
Hey, thank you very much, and that was a very wonderful panel discussion. So my contribution to the data is on the aspect of the local level. Sorry, I am Mashku Loretta Obimdike from Nigeria and the founder of the Green Environment and Climate Change Initiative. Okay, about data, because data is important for solution or for implementation. So for that to happen, participatory approach to data collection is very important from the work that we do, because researchers, scientists can actually collect data, but capacity building on the aspect of the community people to be able to collect these data themselves, because they have been implemented. So if they can be able to collect data and also be able to translate these data for themselves, they will now know how to improve in the work that they do, because if I'm to say, all what we do is actually in a community. So for us to be able to improve in those work, then we need to be able to teach those people how to collect this data so that they can improve in the work that they do. Thank you very much.
Thank you. We have time for one or two brief reflections or questions for our panelists, if anyone wants to ask any particular questions.
Thank you very much. My name is Judith Kaulem from Zimbabwe. I wanted to reflect on what the minister has said about a mindset change. And in my view, I think while mindset change is important, it's also important why people are going into the Lake of Malawi to fish. It's a source of livelihood. So even if information is there and you tell them not to do A, B, and C, when there's no alternative to how they can survive, I think it has nothing to do with mindset change, but probably providing alternatives. And then the second one, I think I liked what Elizabeth talked about, indigenous knowledge, that you go into a community not to build. So I think my point is around the narrative and language that we use. If we continue to talk about capacity building, we are assuming people don't know. But I think if we get the mindset that we are strengthening the capacity that they have, then it will change how we move forward. So really, I think that's where mindset change is required in terms of adopting the right kind of language as we are moving forward with this. Thank you very much.
Thank you. Yes, definitely. It's a combination of both mindset.
Can I simply respond to the mindset source of livelihood? Thank you very much, my sister from Zimbabwe. You are very right that we need to provide alternatives. I'll give an example of the same lake. We had a project, some donors wanted to help the local fishermen to establish fish dams. Obviously not some of them in the lake, operating in the lake, but rearing fish. And the fish that in my area, there was an area where it's a dump area. Mostly we used to grow rice there. So there was some church which wanted to help the villagers to start fish farming. They refused the fish farming because they say, we grow rice here. But most of the time, that rice is not something that they can live on the whole year. And all these fishermen, they refuse to have caged fish, rearing fish, because they say the ones we breed are not as tastier as the natural fish in the lake. So sometimes you can provide an alternative, but for the people to accept that alternative, that's where I need attitude and mindset change is also very key. Thank you.
Thank you, Minister. I think we have a question for one more, a couple of more.
Greetings, everyone. My name is Upendo Mwakyusa from Tanzania. So I wanted to contribute something concerning data, and that is on the processes of data collection. I think it is very important to make sure that there is effective participation and inclusion of local communities in data collection, rather than only bringing out the research or surveys outcomes to them and expecting the local people to work upon them. But if the people be included from the early stages of the processes, I think it will be quite easier for them to work on the given data after the end of the processes. Also, I wanted to add something concerning mainstreaming climate change agenda in different policies, like health policies, agricultural policies, because having climate agenda only on environment policies and on climate change policies won't bring about effective and meaningful outcomes. So if we really want to address these issues, I believe on collective efforts on different ministries, different policies, and frameworks plus strategic plans. So it is very important for our countries to ensure that we mainstream the climate agenda into other policies so as to bring about collective efforts towards addressing the climate shocks and threats facing health sectors and other development sectors.
Thank you. Thank you for your contribution. I think we've got time for one more, and if anyone wants to respond, you're more than welcome to.
So,
Yes.
Good morning. My name is Mushiri Nyaga. I'm from the Local Development Research Institute. And I wear a couple of other hats. Good to see some familiar faces in the room. Glad Wellcome Trust is here. And this is specific because of the support from Wellcome Trust in the past and the present. There's at that nexus of data and of health and climate change, you have the issue of climate-sensitive infectious diseases. And I've been curious the extent to which you're observing countries that are preparing their health systems a bit more deliberately for those kinds of diseases in the face of the kind of climate change impacts we're seeing. So, from where you sit at the Ministry of Health, within civil society, at UNFCCC, at Amref, Dr. Githinji, I'd love to hear your views on how we're working towards that. Thank you.
Okay, thank you, Javier. I'd just like to respond to this. I think investing in Africa's data capabilities, for me, is critical from where I sit at the multilateral level. I see a huge gap. I think just by doing that and bringing in the visibility of Africa's health data into the climate negotiations will not only provide you with political leverage. And this is not just political leverage at the multilateral level, but also political leverage at the national and local level. I think what you need as we go to Belém, and in Belém, there will be a huge discussion and hopefully an agreement on the global goal of adaptation indicators, is having data that is visible and being able to articulate and narrate those compelling stories and evidence at the platform to ensure that Africa's perspective is well represented in that global stage. I think the need for quantifiable, I will not understate that. People, negotiators work with concrete data. They work with quantifiable data, and therefore that there is no discussion or negotiation about that. They will need that as soon as possible and as fast enough as possible. But thirdly, as we move to implementation, it's about actionable data. So not just narrating the stories, but moving to solutions, as you said. Let's offer the options and solutions that are required to ensure that our communities remain resilient, but are also able to take climate action.
Thank you, Dr. Njenga. We've got
just a closing thought.
Yep.
I think 2 points here. One is that we need a paradigm shift. from the business as usual way of doing things, way of research, data collection, data storage, data sharing is very important. So we need to really that contextualized, Africa-driven data, and that assumption that communities have no solution on their own, that we need to impose ideas on them, we need to extract ideas on them, I think should end. So with the new data centers, I believe that is the way to go. The other point is about capacity building. We have misinterpreted capacity building. So we said really those usual workshops we do on capacity building is more accompanying, ensuring that we have communities really working with communities and ensuring that communities define what they want, their own solutions, their own research, their own studies. So this is very important because that is what everyone is, if you go to any meeting, any activity, it's about community capacity building. And when you want to define that, no one tells you it's just gathering people into a meeting and telling, let me build your capacity. I believe that we need to go beyond that. The capacity building is empowering communities, is identifying the needs of the community, is really working with the community, really co-creation as we are doing here, and then ensuring that all understand what they want and they unleash what they have.
Thank you very much. We haven't got time for another contribution, but I just want to close off because we've heard the urgency, we've seen the architecture, these centres and the PPCH. Now we've obviously spotlighted the opportunity. This is not just about the data, but about the equity, the resilience and the scale. To close, I'd like to welcome back Dr. Kinuthia with the final invitation for action. Thank you.
Wow. A big hand for our panel. What a fantastic panel.
Thank you.
And maybe they can take their seats, or do you want them to accompany me here? You could take your seats.
Okay,
thank you very much. We come to an end to this, and thank you, yes, very, very fantastic conversation, and from the audience as well. But it's very, very clear. When I listen here, I'm seeing data as the torch for climate justice. It's the torch that's going to ensure there's climate justice. That data from I'm hearing must be participatory, must be community up, must inform policy, and must be quantifiable and accountable, because then it's important for community use, because data is not only for the use at a global level. It's not only for COP. It's not only for UNFCCC. Data is also for communities, because communities do not wait for the next COP to decide how to handle their flooding. They're handling flooding, Minister, isn't it? Continuously. Fish farming and all the... So they need local decisions for them to decide what to do. And then that data then boils up to inform global process. So we need the data for decision making at a community level. And most importantly, and then that data then informs the top, not only for the top. The data has to be used in a way that it creates community behavior change. And that's the question around what you're calling the mindset. Like, the data must be so powerful that communities learn, and they learn from each other. And when I grew up, there were things called taboos, things you couldn't do because community knew if you did this, it would happen. And therefore, communities themselves told each other, don't do that because this could be the result. If you have data, it could inform behavior change the same way that communities have used data before. We've heard, of course, from Pakja on the advocacy role. We have heard from the youth on the need for this data to also create early warning systems for change, for people to work on what they need to do. As I close, it's to say that the data that we are creating in data hubs is actually convening all these thoughts and principles. We have an approach called the community-based observatory networks, meaning that the communities themselves gather the data they know, including what we're calling citizen science. Citizen science saying what local people know, the weather forecasters, bringing that together with health data, and finally, meteorological data in a participatory manner. Overall, let us use what exists to build what we need for the change that is required. Thank you very much to you all. And welcome and to support the data centers. So if you feel you want to support these Africa Climate and Data Centers, please approach any of us and let us see how to take that conversation forward. Thank you. Thank you.